Classification of antibacterial drugs. Hey there, future healthcare heroes. Today, we're breaking down the classification of antibacterial drugs, and of course, I've got some fun mnemonics to help you remember them easily. Let's dive in. Classification based on mechanism of action. Antibacterial drugs can be classified by how they attack bacteria. Just remember, people can attack my cell properly, because that's exactly what these drugs do. P for protein synthesis inhibitors. Example: macrolides, azithromycin, tetracyclines, doxycycline. These stop bacteria from making essential proteins. C for cell wall synthesis inhibitors. Example: beta-lactams, penicillins, cephalosporins, vancomycin. These break down bacterial walls, making them burst. A for anti-metabolites. Example: sulfonamides, trimethoprim. They block bacteria from making vital nutrients. M for membrane disruptors. Example: polymyxins, daptomycin. These punch holes in bacterial membranes. C for cell division inhibitors. Example: fluoroquinolones, ciprofloxacin. They stop bacteria from multiplying. P for protein DNA interaction inhibitors. Example: rifamycins, rifampin. They block bacterial RNA synthesis. So, if you remember, people can attack my cell properly, you'll never forget how antibiotics fight infections. Classification based on spectrum of activity. Next, antibiotics can be classified by their spectrum of activity, meaning, whether they attack a broad range of bacteria or just a few. Here's a simple way to remember. Narrow ninjas, broad bombers. Narrow spectrum antibiotics, ninjas, these attack specific bacteria only. Examples: penicillin G targets gram-positive bacteria. Vancomycin reserved for serious gram-positive infections. Broad-spectrum antibiotics bombers, these target a wide variety of bacteria. Examples: tetracyclines and fluoroquinolones, effective against both gram-positive and gram-negative bacteria. Carbapenems, powerful broad-spectrum drugs used in severe infections. So, narrow ninjas, broad bombers helps you remember which antibiotics are specialists and which are generalists. Classification based on bactericidal versus bacteriostatic. Now, let's talk about whether antibiotics kill bacteria or just stop them from growing. Use this mnemonic. Bactericidal kills, bacteriostatic stalls. Bactericidal kills bacteria. Example: beta-lactams, penicillins, cephalosporins. Fluoroquinolones, ciprofloxacin. Bacteriostatic, stops growth, lets immune system finish the job. Example: macrolides, azithromycin, erythromycin. Tetracyclines, doxycycline. So, just remember, bactericidal kills, bacteriostatic stalls. And that's a wrap. Let's quickly recap. People can attack my cell properly, for mechanisms of action. Narrow ninjas, broad bombers, for spectrum of activity. Bactericidal kills, bacteriostatic stalls for how antibiotics work. Got it? Great. If you love these mnemonics, hit subscribe and stay tuned for more fun and easy medical learning. See you in the next video.